You see, a lot of dentists out there will just try and make you a night guard to correct your clenching issues. But that may not be specific to your issues and certainly won't help you with the root cause of clenching. In this video, we will go over most of the possibilities as to why we grind our teeth at night and also why they hurt when you wake up. I'm Rick Buck. I've been a dentist for 15 years, so like and subscribe if you have teeth. When your body senses hormonal or mineral imbalances, for some reason, your jaw muscles respond by clenching more. So let's go over those possible imbalances causing you to clench. Stress is an obvious imbalance that causes people to clench their teeth and is very well documented. If you stress too much, your body will start to produce certain hormones and you'll build up too much and your jaw takes that out on you by clenching a lot. Most people know about stress-related teeth grinding. However, I find that people, including dentists, too often use stress as a scapegoat for why people are clenching their teeth. There are definitely other factors and in my opinion, more common issues that they just don't know about. But stress is definitely a factor that causes clenching. Taking too many vitamins is one of the most common factors I see that causes clenching. I see this so much in my practice and can't believe that it isn't more widely understood. The main culprits seem to be vitamin D, calcium, and metals like zinc and iron that cause clenching, but I have found it could be other vitamins too. I have looked all over the place, I can't find research on this, but in my practice, about half of the people that see me for jaw pain are taking vitamins. Not half the people in my practice, half the people that are seeing me just for jaw pain. So if their vitamins aren't doctor prescribed, I have them stop the vitamins for 2 weeks, and about half of those have their clenching and grinding issues subside. So I find that about 25% of the people that have jaw pain, I take them off of their vitamins for 2 weeks. As long as they're not doctor prescribed, their clenching and grinding pain goes away. I'm not saying this is the case for everyone. Once again, that's about 25%, but there are so many factors that 25% is actually a high percentage, you'll see. Now don't get me wrong, once again, I take vitamin D and some of the other vitamins, but for some people, even a little bit is too much and it will cause this to happen, even if they say it's putting you in normal levels. I also hear people say, but I've been taking vitamin D for years and this problem is recent. All I can say is that things change, and when I have them stop for 2 weeks, about half of them, the clenching and pain stops too. Now, why the clenching with the vitamin D and calcium and why the jaw? I only have a plausible explanation. You see, there are some muscles that are very essential to survival that you may not think about, but your jaw muscles for chewing are completely necessary. Also, your postural muscles like your back muscles are also important. For example, if your back muscles didn't work, you would just be a blob on the ground. It seems that these muscles get the lion's share of vitamins that they need to work. It just so happens that your muscles need calcium to contract. Well, if they have too much calcium, it appears that they are more likely to involuntarily clench and tighten. Vitamin D's role is that vitamin D helps your stomach to absorb calcium. In fact, I wonder how many people have back pain or jaw pain because they are unaware they take too many vitamins. Anyway, I would stop taking vitamins for a few weeks if your vitamins aren't doctor prescribed and see if it helps you. If it doesn't, go back to taking them. Moving on, some diets and exercise programs also cause imbalances that will cause clenching and grinding for some people. I have found this especially true for exercise programs that push you to the point of exhaustion and extreme runners. So I would try a low intensity workout for a while and see if that helps. Also, pay attention to your diets. While some diets are great to avoid junk food that your body just doesn't need, other diets may be void of what your body does need, which for some causes clenching more. Next, medications. Even if necessary, they can cause clenching as well. A lot of times, antidepressants like Prozac will cause clenching as a side effect, and this is well known. But I'm also sometimes suspicious of other drugs too. For example, I take Afrin sometimes as a decongestant. When I take it, my jaw inevitably becomes really tight and sore. It does the same thing for my wife. It's not known, it's not in any medical journals, but I even asked a patient with sinus problems one time about that and they said the same thing, that they were on it, makes their jaw tight. As a last resort, sometimes I will have my patients ask their doctor if they can switch meds or at least lower their dosage as a trial to see if this stops the triggering of their clenching. But always ask your doctor first, especially with antidepressants. People that are dehydrated are also definitely more inclined to clench their teeth as well. This is difficult because normally there is something like a medication causing dehydration when people are dehydrated. So it may not be as simple as just drinking more water if you're dehydrated. For example, caffeinated drinks can be a cause of dehydration. Medications can also be a cause of dehydration. I know I've seen a lot of people with dry mouth due to taking various medications. Exercising too much, as we have already covered, can dehydrate you. Maybe even working out in the sun can even further dehydrate you. So yes, you need to drink enough water, but your body knows how to regulate its water, so look for one of these outside factors as well. Before I go on to the other common causes of clenching, I want to plug my best daily brushing and flossing routine video. It will show you how to optimally take care of your teeth with all the best products I have tested out in other videos that I've made. These products include my favorite floss, toothbrush, and toothpaste by far. You can see why they are my favorite with stunning results in a video that will pop up at the end of this video. Sinus issues like allergies and sinus infections can also cause clenching. I've seen people going through tough allergy seasons that start to clench their teeth to counteract the pressure they feel in their sinuses. Then even people that get sick with sinus infections start to clench their teeth too. The good thing about clenching due to sinus issues is that we normally will know, because when the sinus issue stops, so normally does the clenching and grinding. The funny thing is the remedy to sinus issues is sometimes taking medication that resolves the sinus issues, but it just so happens Afrin and maybe some of the other sinus medications will increase clenching as well. Just gotta wait for it to go away, and that's the good news. There are also imbalances in your sleep position. For example, people will sometimes use firm memory foam pillows that advance their heads forward too much when they sleep. For some reason, this unnatural position sets off an imbalance that causes people to clench their teeth at night. Now, your head being too far forward is just a common example, but it doesn't have to be too far forward. It can be other positions too. Normally, if this happens, a bunch of other neck, head, shoulder, and back muscles will also become sore. Why? There are many explanations for why this happens. Generally speaking, all the muscles are overworking to compensate for an unfavorable position, whatever that might be. I recommend in this scenario trying a bunch of other sleeping positions, even if it's using a flat or no pillow, if you can. Some people with back problems can't do this, I understand, but just trying a different sleeping position in general might help. Moving on. This may seem counterintuitive, but people with sleep apnea tend to clench their teeth. When you sleep, all your muscles start to relax, and for some people, when they sleep, the jaw muscles relax so much that everything falls back and kind of closes their airway. The problem is this lack of oxygen momentarily takes them out of sleep, where the muscles then become more active and awake while sleeping. The jaw then clenches to try and keep the airway open because it notices it couldn't breathe. Now, your body does this and it works for a little bit until you start going into deeper sleep again, and then your muscles start to relax and your jaw falls back and the whole thing starts again. So the best way to do that is to see your doctor on how to deal with the sleep apnea. There's a lot out there on how to cure sleep apnea. It's probably best that you see your doctor. Losing weight is always a good thing. There actually are jaw surgeries that can help that too. Now, moving on again, there are a few people out there that are just genetically programmed to clench their teeth more. But I wouldn't settle on that or think that's you until you've explored everything else too. Here are 9 things that I go over with my patients that normally stop the excessive clenching. First, I have them stop all the vitamins and supplements that are not doctor prescribed for 2 weeks, especially vitamin D, calcium, and metals like iron and zinc. Second, I have my patients go back to a balanced diet if they are on an abnormal or restrictive diet for 2 weeks. Third, if they are on an intense workout program, especially one that pushes you to exhaustion, then I have them go to a way less intense workout for a few weeks. Fourth, we carry a water bottle to make sure we are hydrated and cut caffeine for a few weeks, as caffeine will dehydrate you. But it should be noted that cutting caffeine may initially make clenching and headaches worse. But as your body starts to rest appropriately with better sleep cycles and with better hydration, it should help relax the muscles. This leads to the 5th recommendation. Make sure you're getting enough relaxation, rest, and de-stress time. Even if you have to set aside some meditation time, make sure that you get a break from your stress and just relax, however that might be for you. 6th, Get rid of hard pillows for a few weeks. Sometimes we even use no pillow, and if you can't do that, at least just try and switch your sleeping position if possible. If those first suggestions don't get rid of any of the clenching issues, then we move on to the final 3 possibilities, all of which involve talking with your doctor about a few possible changes. So 7th, I have the patient talk with their doctor about their medications to see if we can lower dosage or find any alternative that might help as well. 8th, sleep apnea can also cause clenching, so if this applies, they can talk to their doctor and go get checked for a sleep study and so on. And 9th, if the patient has any long-term sinus issues, they can talk with their doctor about relieving that with temporary decongestants or allergy medication. Just make sure those aren't making things worse. Doing these will help to find and relieve what is causing the excessive clenching for most people. I wish I could say these work 100% of the time, but it is the best place to start, as these are the most common root causes of jaw pain that I have found in my practice. If they don't work for you, then check out my video on TMD or TMJ relief. I go over all the remedies and treatments to TMJ. Everyone should watch my daily tooth care video I have that will pop up right now, and I'll show you why in that video it's the best technique to brush and floss and more. Like and subscribe if you have teeth. I could talk forever about clenching and grinding.